Good evening. Assalamu alaikum. So today we will do the ethics part of MRCPCH exam, and ethics is very, very, very important, and it is very unique as well because whenever we are practicing in underdeveloped country or developing country, it was not in our day-to-day life practice, and some scenarios are very, very rare. So maybe it is in some context or in some reason, it may be just a scenario. But we are expanding and we are now, like we can now imagine how it would be. So ethics require to understanding their social perspective and how they are, doing their activities. So it's like some imagination is required for some personals who are not working in UK. So sometimes it is difficult. Yeah, really, it is sometimes difficult. But without ethical part, no MRCPCH exam is possible. It's even it is required in the clinical part of the exam. So ethics and safeguarding is very, very important. The topics is mentioned in the your syllabus. If you go through the it RCPCH syllabus portion, here it is mentioned ethics and safeguarding, but it's cover everything. Ethics and safeguarding is more or less same things. So let us discuss the ethical part. So if we discuss that what is ethics is, for us maybe it is initial part we will think over, it is something like imagination, it is something like this, but for theoretical point you have to know that ethics is based on 4 principles. So first principle is respect to autonomy. That means everyone having own decision. Okay, so everyone can take their decision. So this is the autonomy. That means you are taking your decision. But problem is in pediatric age group, so it's from 0 to 18. So, some childs can take their decision because they have that mental capacity. They are matured enough, like 15 years and above. But age is not fixed for the maturity of taking decision. But some childs, it totally depends on the parents. Okay. So this is the respect for autonomy. Sometimes this autonomy is restricted in pediatric age group. Then non-maleficence. Non-maleficence is second pillar of ethics. It means whatever you are doing as a doctor, you have to do for the best interest of the child. That means you are not harming the child. Maybe you are taking blood from the child, like you are taking blood from the cannula, but through a cannula, but you are not harming, although it is taken out of blood, right? So it is everything should be not harm, non-maleficence, and beneficence is everything would be for the best interest of the child. So whenever there is a confusion, should I do it or not? We have to take these things that it should be beneficence. It should be the best interest of the child. And the fourth one is judgment. So whenever we are dealing with some kinds of patient, then it should be judgmental and should not be judgmental in comparison to social status, religion, or any other things. But yes, we have to be judgmental whenever it is our clinical perspective. So which one is most important for the best interest of the child? For example, some child came to me among them. So everyone is saying that I have to see everyone's first, but how I take my decision. So those are most emergent. Then I will check the patients who having this emergency. Okay. So this is the judgment, how I take my decision. So first of all, this is the exam way. Just we have to know this name, respect for autonomy, and what does it means? That means we have to take the, we have to always respect to their decision capability. Okay, those who are applicable. And then it's, of course, it should not be do not harm, beneficiaries for the most interest of the child, and it should not be male judgmental. It should be appropriately judgment. And this ethics is applicable for everywhere. But, when the ethical, when we have to apply our ethical points of view, it can be different across UK. So Great Britain is composed of several other area like Northern Ireland and inland. So 4 areas. It is different across UK. Law is different, but in the exam it would not create any problem. You have to know the main things, then it would be okay. Not you have to know all the rules. And here very important things in whenever we are discussing the ethics, that young people can take decision. That is very important. Young people can take decision. Young people doesn't means that they are shy, they will not take their decision, they have no capacity. They can take their decision with some exception that we will discuss. So if child cannot take their decision because of their mental capacity is not that much, in that times their parental will be take their decision. But if parents is also not possible, then registered senior consultant who have that experience, at least register and above, will take the decision. So always we have to explain to the child, even whenever, I mean, you are dealing with the child of from ethical points of view. Even the child is 2 years, 3 years, but you are doing something to the child, then you have to explain, now I'm doing these things. So it's like a one kinds of norm. So I will ask these questions at last, because it's I mean depends of many understanding. So here important things is confidentiality, that now we will discuss. Confidentiality is very, very important. Frequently, if you are in a NHS employee, then frequently they give this mail that you have to maintain the confidentiality of the patient. So confidentiality means you are keep their patient's information confident. You are not spread the information. So it was said that even you could not gossip with your colleague about patients. It is true or whatever, you could not do this because it is their personal information. You cannot gossip, you can, but yes, from clinical points of view, without mentioning the name, we can discuss, but whenever there is something, it is even applied for the child. Okay, so confidentiality would be there. But when they can lose the confidentiality, it's very important. So confidentiality can be lost. One of the things is public interest. Then it is very important for the public. For example, you know that a child of 15 years is already get their driving license, DLA, driving license he got, and he is drunk. Okay, so he's regularly doing driving, but he is our alcohol level is high. So in that case, it can cause accident. So you have to inform this. So you can break the confidentiality. And you have to give this information for the best interest of a child, young persons who do not have the maturity. So for the best interest of the child, you have to give this information. For example, you got a child, HIV report become positive. So you have to give this information to the parents, because child um, cannot hold this information, cannot change this, cannot take the responsibility, okay? And required by law. So everything, if asked by the law, then you have to give this confidential. It is easy, very easy. So confidentiality have to be maintained without these three cause. So you can break. Then go for the, but before that, any confusion with the confidentiality? Okay. If it is not, then go for the parental responsibilities. That is a great question. What is the responsibility related to the medical ethics? What is their responsibility? And who is parents? It's also become an issue. So parental responsibilities is fulfilled by the mother. So mother means here biological mother, give birth. Who give birth, biological mother. And another things is married father. So here father is actually two types. One is married, another is they're not married, but their name is there within the birth certificate. So birth certificate, if they put the father name, it means that this child, this father have to take responsibilities. Okay. So if it is like mother name is only mentioned and mother is not married, by the, I mean, it is not any, no documents is there, then mother is only the responsibility. Okay. So then father is there. Those are married. If unmarried father, then have to be written in the birth certificate. It is written somehow different, like since 2002 and 3, because this law is applied from 2022 or 3. So after then, if father name is registered in the birth certificate. Okay. So that is the things. They are doing the parental responsibility. Somehow, if mother cannot do the parental responsibility, for example, mother age is mother age is like 17, 18, then mother cannot do this responsibility, maybe. Or mother is mother voluntarily if say that I will not take any responsibility for the kids. Yes, it's happened. Then social service will take the responsibility, because social service is doing this task. Okay, social service. And there are something more things that you should know. Foster baby, foster care. So foster care means there are some like family, or sometimes someone is voluntarily take other kids responsibility. Maybe they are taking care of their own kids, but they are thinking that we can taking care of more kids, and so they got trained up, and then they taking care of other kids. They are getting some money from the government or the responsible authority. So this is called foster care, foster parents. Okay, foster parents. This is, so if it is there that anyone having no parent, or no parent is taking the responsibility of a child, in that case social service will take this decision and they can give it to the foster parents. It's one kind of charity, and sometimes it is one of the way of income also. So is it possible that parent is a murder case? So do murder, mother is do murdered and in the prison. So is they lose their parental responsibility? Lose? That is one of the things. Is they lose their parental responsibility if they are doing something very unsocial? So there is a big no. It came sometimes in the question that yes, no, they are not losing their parental responsibility for the any kinds of which is not socially accepted. So in that time, what do you think? When they will lose? What's the time? So the time is if they divorce. Okay, so they will lose their parental responsibility. Like parents are now divorced, so they lose parental responsibility. So this is also no. No. They are not losing their responsibilities. Still, they have to take their responsibilities. Or if the child is already in foster care, so they lose their parental responsibilities. So I'm telling you that child is already given to foster parents. So are they lose their parental responsibilities? Lose? No. No. They will not lose their parental responsibility. Still, they have the responsibility. For the time being, maybe are not capable of taking the day-to-day activities of the child, or anything can happen, but the responsibility is not lost. So only it can be lost by the court. Okay, the court. That is, you have to remember that court can declare that these parents will no more are responsible, or they cannot take any kinds of action for the child. Okay, and divorce does not signify loss of parental responsibility. That is also important. So step parent, this is an issue, it is common. So if step parents, so they can get parental responsibility when they got married, or they are civil partner. That means those who are doing live together, so they also can get a parental responsibility whenever they have some written agreement. So it is that depends on the uh, agreement. Okay, so they are married and they write it there, or they are civil partner but they write it doing agreement, or it is done by the like it is declared by the court. Okay, so in that case step parents can get, like mother, stepmother, but they can get the parental responsibility if it is declared by the court, or they have civil partner and they are like they are do some agreement. Okay, so this is the one of the things. So regarding responsibility parental, we have to know that some responsibility can be transferred to the grandparents, childminder even. Okay, so how it can be given verbally or by written. So grandparents sometimes take their childs to the immunization center. Okay, so it was declared, and usually in one GP center, one GP centers means those who GP centers are like outdoor activities with some indoor activities, very little, and in a defined locality. So there, this locality GP doctor is known that this child vaccination schedule is made by the grandparent. Okay, so this is one of the things. Childminders, so some take childminders because some parents are busy, so they cannot take the responsibility. So childminders is taking the child to the school, and they are taking their child from the school. So childminders is something like 2 hours, 4 hours, 5 hours childminders. Some take the childminders for some period. So they also, in one sense, they take the responsibility. Okay. So this is from the AKP books, but it is very, very nice way they write that those who can give consent for child or non-companion person, so who can give the consent, and consent is giving consent for any disease procedure or any treatment option. In that time, this consent is one of the things which is done by the parents, okay, for a child who are not capable of giving consent. So can be given by the biological mother or biological father married to a mother at the time of birth. Okay, so but during the birth time or before, they are married. And also biological father, which name is on the birth certificate, same sex partner through a court order, non-biological father only through a formal court order, adoptive parents. So it is one of the things like adoption, very, very important, those who are take adoption, so by the legal way, so they are having all the responsibility to the child like a parent, and it is given by the court. It is not like I will take this child responsibility and I'm saying and then I become adoptive like parents. No, it is by the court always. So social worker, through the court order, if it is given, they also can give the like consent. Medical practitioners sometimes require in extreme case. I will explain it later, how the medical practitioner also can give the consent. But other things I already discussed. Okay, so I said you that vaccination can be given, consent can be given to the, it is by the parents, but it can be taken by the grandparent as well. But it is a oral consent, it is not required written. In the task case, there is also important one thing discussed. It's you should know that sometimes like you are dealing with a child and you see the child is very emergency situation. So child require emergency protection. For example, this child is not safe by the parent. They are maybe you think maybe they are not safe for the child. Family is not safe for the child. In that case, you have to give EPO, emergency protection order. So it is also given by the court, but you have to ask for emergency protection order, which can be up to 8 days, can be extended further 7 days. So 2 weeks emergency protection order. That means whenever court is involved here, the court can keep the child away from the parents up to 2 weeks, away from the parents up to 2 weeks. But if the child is not safe and it's proved during this 2 weeks time, all the investigations or the committee will be from, it is called, committee, ethical committee. The ethical committee will form and they will discuss this case, and then they can take it to the court, and then the child can be withdrawn from the parents. Withdrawn from the parents permanently even. Of course, it is by the court. And there is a one consultant responsible for every trust, which is called safeguarding consultant. Safeguarding consultant. Okay. The committee must be, a committee will be formed, and then they will take the decision. So is it clear up to this? Any confusion? Who will be parent and who will be the parental responsibilities? And if it is not there, then what will happen? Any confusion with this? If it is not there, then let us discuss who will give consent for treatment. Okay? Who will give the consent for treatment? Already we discussed that consent for treatment, for example, a child require lumbar puncture. So who will give the consent? So first of all, we have to remember child can give the consent if they have mental capacity. So it is called competence. So always they use this word, competency. If the child is competent enough to understand what will happen by this procedure and what could be the drawback, then competence is important. And if the child is not competent, then parents will take this decision, giving consent for treatment, okay? And court order is usually there. And now it is written by the ethical books. There is called, everything is taken from books. There is a ethics books, okay? So it is written that usually 16 years they become capable, or more than 15 years they become capable of giving consent. But remember, age is not fixed. I'm repeating so much important. Many scenario is very, very confusing. Ethical scenario is really confusing. I'm so sorry to say that really ethical question, ethical scenario, ethical recall is very, very difficult. Okay. Okay. So it is not the depends on the age. It is depends on the maturity. Okay. So although it is written that usually they become capable of from 16 years, usually. So it depends on the maturity. Even 15 years, if the question said that the child is matured enough for the taking decision, but the child age is 15 years, go for this. No problem. They can give the consent. So sometimes it's happened that child's having no capacity. So the child is 13 years. So who will give the consent? Both parents? You have to ask from the both parents. Okay. So the both parent is there, like father, mother, and they have the capacity. So but the problem is when they are not agree. So if there is a disparity between the parents, in that times you have to take from the legal decision. Okay. So you have to take it from the court, or the consultant will take the decision. So consultant, remember, whenever any problem in the ethics, then go for the consultant, senior, register who have this experience dealing with the safeguarding issue. Encourage to discuss parents of young. Okay. So sometimes this questions is sometimes young child, for example, 16 years old girl, uh, they want 16 years old girl want oral contraceptive pill. Okay, they can be take their, and you understand the 16 years old girl having the capacity to take the responsibility or take the decision of taking oral contraceptive pill. So what you will do when the child having this capacity, but parents is not involved here, in that times you will just take the child's here consent or not. Yes, you will take the child consent and you will give the OCP, but remember, this girl is still under 18. Under 18. So you have to, whenever the child is under 18, so you have to always encourage them to talk with the parents. Encourage to talk with the parents. Okay. But you will respect their view, and cannot override if competent. Okay, so 18 years, 16 years, 17 years, less than 18 years. So always you have to encourage them to talk with the parents, but you have to understand that parent cannot override if competent. Parent cannot override if competent. So here is problem. Do you want to disclose this information of taking oral contraceptive pill to the parents? Who will disclose? Is it break the confidentiality or not? Please respond. Do you think that you can disclose? You can't disclose the information because taking oral contraceptive pill doesn't mean that the child is in danger. Child is sexually active. So here child is under 18. Still you have to, whenever you take this decision to give this OCP, so if you have any concern, every time you have to ask question to keep the child safe and sound, and you have to inquire the child is understand the safe sex practice. Okay, so they understand the safety issue, and you can ask the age of the partner for a female. Okay, so very large age difference indicates some problem for their perspective. Like it's not mentioned what is the age difference is require immediate step. So it is not defined. More than 10 years, if there are any age difference between the partner, it's required to be concerned by the health professionals that is there any other problem, because child trafficking is there. They are not safe country 100%, or they're not safe. So if you see the crime rate, you will see that their child trafficking is very high. So some childs are taken from the other countries, and then they do the adulteration of the childs, and then they sell the childs for sexual activities. So always have to be careful for the health professional. Okay, if they seek help, then you can give the this advice. So here in other things, if any religious perspective to not to give any for example oral contraceptive pill or like DNC or something by the doctor, so they can say it appropriate way that I'm not going to give you any support for this, but they will show which colleague can help you. Okay, so that's the way. And for the child, any research study, if they are not only the treatment, then must be all the research study for the child must be approved by the ethical committee. It cannot be done without ethical committee. Okay, so some questions is there like parents can refuse immunization. So child having not that much responsibility, so parents can refuse. I will discuss this case later. So the parent can refuse or not. Yes, parent can refuse the immunization because it is not any immediate danger. Is it any immediate danger? Parent refuse immunization. Is it any immediate danger? No. But any child having perforation, for example, and parent refuse to do exploration of their surgery. So it is deemed necessary. Without it, child can be die. If consultant understand this, then they can take the child to be open by the ethical committee. So ethical committee form an ethical committee will take the decision to open the child's tummy. Okay. To understand that sometimes for the best interest of the child, that is the one of the our here we said that ethics having four pillars. So one is the beneficence. So this beneficence will be applicable here. Even parents wants to deny the treatment, or in that cases consultant can take the decision of continuing for the best interest of the child, but it will be done with ethical committee, and immediately they can take the decision, but other colleagues will be there for, I mean, sometimes verdict also required, you know, sometimes a parent can issue like against the consultant or against the doctor, against the hospital, so that some evidence is there. Okay, so this is everything is the best interest of the child, but naturally parent can take the decision if not any immediate dangers. For example, if it is like a child with uh, child is having no problem, but immunization if not taken, then what is the problem of this specific child? Any problem, but you have to counsel the child, parents, that immunization is very important, and you know, but herd immunity can protect the child as well. So you cannot I mean, you cannot misbehave, or you cannot assume, or you cannot be judgmental. Is the thing. So let us discuss AKP case. It's actually AKP case. Yeah, but very important to understand. 12 years old boy seen in the clinic by the foster mother. So with the foster mother, you understand? 12 years old. He is voluntary foster care, and his mother has recently been sent to a prison. Sent to a prison. He has a large skin tag on his ear, and he's being teased at school about it. So for skin tag, child is very much worried, and the child mother, biological mother, is on the prison. He's keen to have this surgically removed, and his foster mother is in agreement. His biological father died recently in a car crash, but he has met his paternal grandparents, and they live nearby. His parents were not married. So which of the following can give consent of any procedure of surgery for this patient? Assigned social worker, foster mother, grandparents of the birth father, mother, and senior pediatric surgeon. Who will take this consent? He is only 12 years old. Can you please write it? You say AKP. Mother is in the prison. Still? Yes, still mother is, I said you that even mother is just required uh, to be the way they can take the decision. So grandparents is not here because it was not given. This responsibility, grandparent is not taking the parental responsibility. Sometimes they take the decision, sometimes they take the parental responsibility when it is given by the parents. Okay, but it is not a big issue. It is only for the, it is written only for the immunization. Okay, so others it is not mentioned anytime. Immunization, you have to give the schedule like this way. So every time have to be come, and if working, then it's maybe difficult for them, have to take the leave. Many things is there. So be careful about this question. And then if the biological father had not died, which of the following individual would have the responsibility regarding the operative consent for this child? Read out and take your decision. Assigned social worker on behalf of the local social service. Biological father name on the birth certificate in January 2004. There has been no contact for 5 years. Biological father who was not married to mother at the time of birth is not on the birth certificate. Current partner of the mother who has cared for the child for last 5 years, foster carer. So yes, it is B. Very right. Biological father name on the birth certificate may be not contact, but it is not only in the biological father birth certificate it was mentioned. Okay, so it is commonly these questions came, okay, for both exam. Now female genital mutilation. Female genital mutilation. So female genital mutilation is very important here. It is some ritual, some areas ritual, not religious ritual. It is some areas ritual, especially Sudan, where female genital area is changed by cutting. For example, labia majora, labia minora, clitoris, try to make it sharpen. So female genital mutilation is totally by the law is prohibited. It is not permissible. It is a police case. They have to send to the police. So police will be here informed. I mean, as a medical doctor, if any child, if you are examining and you see that their genitalia is excised and the child is not any problem. So the child having no urinary incontinence or any other problem, but female genital mutilation already done. Even in that times, you have to send to the police. But if it is intended to do this, like you understand that, for example, they are going to visit their home country for a cultural program. They're saying, and you understand that female genital mutilation could be done. So it is not already done. I'm repeating, it's not already done. Could be done. If you are suspecting, in that time, you have to refer to the child. You have to refer to the social care. But you cannot inform to the police because it's not done. And they are not agreed that they will done it. So parents is not saying you that I will do these things whenever we were in Sudan or the same type of country. So refer to the children social care. But if you see that child is already female genital mutilation was done, in that cases their siblings are is risk. So their siblings, you have to refer to the social care to the family so that other kids are taken care, other kids are look after, and they keep child is in safe place. So many things is there written, but not required to go in very much deep how it is. Okay, like too much theoretical is not required. Um, so if you see that it is already done, you will call the police, and it is said here 101, and also to the social care. Okay, social 101 to the means police. So brain death issues we will discuss later. Before that, ethical points things we will complete it. After then we'll go for the brain death issues. Okay. So female genital mutilation, I hope it is cleared. It is totally not acceptable by the UK's laws. And some portions that they are related to this. So another thing is Jehovah's Witness, which is practiced by the some Christians. So it is not all the Christians. Some Christians follows this Jehovah's Witness, that means they are not accepted blood transfusion. So any kinds of blood or related products they will not take or they will not give. So this think it is they are against their God wishes. So what in that case is if the child require blood, okay, so in that cases you have to take the consent from the child. If the child is capable, so they can take the decision of giving blood transfusion. But if it is they are not capable or child is against the rules but is deemed required, so what will do? So in that cases you have to give the blood transfusion in emergency situation by the court order. So you have to counsel to get to give the blood, and if it is not emergency situation, even you can involve the religious person for the Christians. Okay, so counseling is there, but if it is deemed necessary, then you will take the decision. The parent cannot override their decision. Okay. Now another thing is contraception. Contraception. Okay, so contraception, before going to the contraception issue, sexual here relationship, any child sexual relationship less than 13 year, any child having sexual relationship is considered to be rape, because less than 13 years they are not capable of giving decision. So understand, it is a foolish case. So we said female genital mutilation, and now one of the foolish case, and now we are saying sex less than 13 years considered as rape, because they from the study somehow they proved it that less than 13 years they are not capable of giving any kinds of consent for sex. So more than 13 years, if the child came to you for the oral contraceptive, in that cases they are, you understand, they are having sex practice, so you have to encourage the child to talk with the parents, as well as you have to send the child to the sexual clinic, and then you have to give the oral contraceptive pill as well. You have to keep the confidentiality. If child say, please don't disclose this information to my parents, then you will not disclose this information. The point is, you are the trust. Okay, so you become a trust issues here. No, the child is not sometimes believing or having some problem, adolescent child with their parents. So at this age they have mood swing, and they think that I'm become bigger, I can take my decision, and they have conflict with the parents. So if as a doctor you lose their trust, so where they will go? So they can take the wrong decision. So as a doctor you can help the child to take that decision by counseling. This is the things it's written in the books. Other than operation, so this is actually what we discussed so far. It's just a repetition. So any operation who will give this decision. So if emergency, parent present will take. If not parent present and child is not capable of taking decision, so in that cases consulted by the two seniors, or two seniors will be there. Okay. If not emergency, then child, as well as if one parent having dispute with one decision, in that cases court. This is a RCPCH. There is a course, ethics and safeguarding. There is a course, 300 USD, 300 USD of one only ethics and safeguarding course. In that course, this questions was discussed, that 45 years old mother of a healthy 9 years old boy has recently diagnosed with Huntington disease. She would like her son to be tested for her disease, although he is unaware of the diagnosis. She requested that blood tests to be taken for genetic analysis without telling him of its purpose. What is the most appropriate course of action? So before taking answer from here, you have to know that, you know, here the screening test. So the child can be, can we take the screening test? Okay, it has some restriction. For example, if you say that parent having breast cancer and they wants to know the genetic analysis that girls can also be susceptible for breast cancer or not. So genetic analysis can be applied for the child, like daughter. So it is no, because usual age of presentation of the breast cancer is around 40 years. So if you take the decision of taking the genetic analysis, somehow it becomes positives, then there is two things. One is beneficence, another is maleficence, the ethical law. So I said you one scenario, and that will be discussed again. But now I'm telling you, a mother having breast cancer, and mother wants to know my daughter also can be in her life to be a breast cancer. So genetic analysis, sometimes some genes is there, BRCA1, 2, some genes is there related. So in that cases, you have to know that is it can be it is it a, can be done by the request of the parents? So no, for the breast cancer it is no, because their usual age of presentation is 40 years. But which ethical point of view we are taking this decision? One is beneficence, another is maleficence. So beneficence means you have to do the test for the best interest of the child, but what in best interest you can give for this child? So the child, if comes to know that he can be going to have the breast cancer, then the child can be mentally low. Okay, so it cannot be it cannot give any benefit to the child. You cannot start treatment. Rather than maleficence, you can be is there any harm? You have to give the beneficence and you have to remove the maleficence. No, do not harm. But yes, if they understand that breast cancer can be there in later life, so the child can be mentally low, she can be like labeled by the society, by their friends, that this child is going to be affected and she cannot get a normal life. Okay, so she cannot be take any benefit from the bank and many other things. So as you can give any benefit, so it is not applicable. But polyposis coli, so this is one of the disease. If it is there, then you can go, if because their age of presentation can be 10 years. So you can go for the test analysis, screening test. For this child is 9 years old, and this child, parents wants to know Huntington disease is possible or not, because Huntington is an autosomal dominant disease and they can be transmitted from the family. And Huntington is some things like there is no cure, there is no remedy, so you cannot change anything. But who will take this consent? Child is not matured enough to take the decision to go for the screening test or not. So in that time, agree to take blood from the body. So you will take this agree, or you will defer testing until the boy is GILIC competent. Okay. Another things is, another is explain that testing is only needed if he develops symptoms. Explain the test is not necessary as gene therapy is being developed for the disease. Inform the boy his mother diagnosis, ask if he would like to be tested. tested now. So is testing is not possible, as 9 years child will not understand. Usually the test is not necessary because gene therapy is being developed, so it is not I mean, gene therapy is it's not now proved for all the cases. Explain that testing is only needed if developed symptoms. No, it is not like this. So it is they have to wait for the Gillick competent. So what is Gillick competent and what is Frazier competent? So Gillick competent means child having, whenever the child have mental capacity, then they will take the decision. It is called Gillick competent. So the child, when they got the mental capacity, could be 15, 16, so they can take the decision. Otherwise, you will defer the test. This is called Gillick. We discussed already what is competency. So it is named as a Gillick competent. Another is a Frazier competent. Frazier means taking the decision of contraception. Contraception related things is discussed in a Frazier competency. Okay, so Gillick is one person who written many documents, say case studies, and then they prove that the child can take the decision even before 18 years. So I hope it is clear. Now, when the child is very premature, in that times, how you will take the decision? Premature child. Okay, so the child when premature, so how you will take the decision? Extremely premature guideline. So sometimes some child born before 22 weeks. So it is in that times, if parent ask that I'm now giving birth of this child less than 22 weeks, so will they go for resuscitation or in ICU care? Will they get? So no, because it is not possible to be live. Okay? And if it is 22 weeks but not 23 weeks, so less than 23 weeks, in that time should not, it is written that it should not be done. If parents request, then the consultant can take the decision. So it is also no, it depends on the consultant on request of the parents. So they can say that at least go for the resuscitation. So whatever parents ask, but it's the main their decision taker is the consultant. It is written here nicely. It is the best way. Even it's required for other exam as well. You know, for every exam, this sub books things is required. So it is written that standard practice should not to resuscitate the baby. Resuscitation only be attempted and intensive care offered if parents require resuscitation, and reiterate this request after thorough discussion with the experienced pediatrician about the risk and long-term outcome. If the clinician agree, then it is the baby's best interest. So for the best interest, there is called a study, which is epicure study. They take a lot of neonates and they study. So they see that in this age group, if the child's even given the like neonatal care, but they have long-term NICU stay, and after then NICU stay, whenever they go to the home, so they cannot enjoy even the first year of first birthday, and even they cannot be capable of giving anything to the society. So what's the, here is our resources. Resources is, we have limitation of resources. So whenever we have to give these resources to the, like any persons, maybe anything. So we have to be judgmental. This is the fourth law of ethics, to be judgmental. Is it really benefit for the child, and it is really benefited by the society by this use of resources? Okay. And then 23 weeks. So it is now 23 weeks. In that times, it is said that it's not only the parents' wish, clinical judgment is also required. So mainly here, parents, if wish, then we can give. Clinical judgment mean, so the child is born at 23 weeks, but multiple congenital anomalies. If it is there, so for example, anencephaly, so what's the benefit? Give the NICU care and something, because the child will not be survive, or even if survive, they having no hope. So no hope issue. It's very difficult to predict the future outcome for an individual baby. Precedence should be given to the wishes of the parents. So precedence here, parent. Remember, 23 weeks, parent precedence is there. However, so parents have these, parents having these types of decision have to be taken. They will have to take care of this child for a long time. So maybe it is difficult. They will counsel everything. Okay, there is some possibility to be survived. So parents, if can take this decision to be long time, giving all the support in that time, all the support will be given until it is very crucial, like they will not survive. So clinician or neonatologist decision is there. However, where the condition of the baby indicate that he or she will not survive for long, clinicians should not be obliged to proceed with the treatment wholly contrary to their clinical judgment if they judge that treatment would be futile. Okay. But it is also said clinicians should not be obliged to proceed with the treatment wholly contrary to the clinical judgment. So if it is contrary, even parents will wish, so clinician can deny. Now 24 weeks, normal practice is 24 weeks, they will get all the support. Okay. But again, 24 weeks, there is a lot of disability. Okay, so it's required to get parent and clinician wish both. So here also parental wish is important. Normal practice should be that one baby will be offered full service, NICU service, support from birth, and admitted to intensive care unit unless the parents and the clinician agreed that in the light of the baby's condition, it is not in his or her best interest to start intensive care. 25 weeks and above, intensive care should be initiated and the baby is admitted. 25 weeks means whatever the situation, baby will get the care. 25 weeks, it is not only depends on the parents. The child will be admitted unless incompatible. Some congenital anomalies child cannot be survived. That is different issues. Okay. So any confusion with this, very, very important for the exam. Very, very important, even when your theory exam. So when neonatologists will be must during the birth time, less than 27 completed weeks, less than 7 completed weeks. There is one saying, RCPCH ethical course. Okay, a woman of 23 weeks gestation who is in labor requests to see a pediatrician to discuss plan of management of her baby. Choose the most appropriate response based on the current best practice. So resuscitation will be future in view of the baby's gestational age. Plan for resuscitation will be based on solely on parental wishes. Full resuscitation will be offered as survival of infants was now common. The baby's condition at birth will be determined the extent of resuscitation offered. Delivery of cesarean section will be the chances of survival. So you understand 23 weeks means depends on the child's situation. Okay, at the time of birth, how. So we said that it is 25 weeks, 100% they will get. 24 weeks they can get. Usual practice is there, but limitation is 20 to 23 weeks. Depends on the parental wish and clinical judgment. So is it clear? Okay. So now we will discuss about abuse related. Sometimes child can be abused. Yes, they can be abused, and it is said that most common abuse is they are neglect. Yes, they can be neglected even. So, what is the example of neglect? Child is not brush their teeth regularly. It means child is neglected. Child is you know when there is a ammoniacal dermatitis happening in the nape area. Okay, so it happened. The child is long time in the diaper and having they have some of will be their feces and sometimes and it caused dermatitis. Nappy dermatitis. So it's one of the example of which is an example of neglect. Sometimes it is like child is a diagnosed case of bronchial asthma and exacerbation is there, but child is not taken to the hospital appropriately at appropriate time. And if it is happened repeatedly, it means child is neglected. So if there is a neglect issue, it doesn't mean that the social care will taken away the child. So it means you have to alert the parents that you have to be more careful or you have to search out which is the cause around this. Why the child parents is not that much responsible that it should be. So you have to search out the cause and you have to give a remedy. So neglect doesn't mean social care involvement. Now, physical abuse, yes, sometimes it's happened like foster parents or step parents or biological parents even. They can be physically abused, they can do the sexual abuse, they can be emotionally abused, they can do fabricated illness. So if abuse is there, then question is it accidental or not accidental? This is the dilemma. It is accidental or not accidental. What could be the cause? What could be the cause? So there are some signs which can help you to understand that this is intentional. So whenever there is any injury which is intentional, it is known as non-accidental injury. Nine, non-accidental injury if it is intentional. So how can you understand that it's intentional or not intentional? One of the things is unusual explanation, which is not matched with the child's. For example, any child is only 6 months, but they got injury on their like leg, so front part of the leg and bruise marks. So it cannot be explained because at these 6 months usually child not walk. So how the bruise mark happen? Accidentally fall, it is not common. Okay. Or the child is 2 months and the child having bruise marks over the front part of the body or back part of the body. Child is at 2 months, no child can roll over. So explanation with the ages is very, very important. And then also some injury is really concerning. For example, fracture in the like metaphyseal fracture. So metaphyseal area usually child having no fracture. How the metaphyseal fracture happen? It can be intense force. You have to give intense force, or the fracture in the humerus or fracture in the femur. It's require intense force. So without any explainable cause, like osteogenesis imperfecta, if there, then they can be fractured in the large bone as well, easily fractured. But otherwise, how it would be? So this can feel something that can be something abnormal, or if it is like this problem happen repeatedly, but they are not asking for any help from the physician. So it means they are try to hiding it. Okay. Or child having not that much interaction with the parents. If the child is not interacted by the usual way, even if you give your child a slap, still your child will be with you. Okay, it's happened, like, this is their nature. But if the child having no pain like features, did not cry, they have no interaction with the parents, is indicate something problem is there. Okay, get my point. So you just read out these things, but from the scenario you have to understand. One of the injury is bruising. So if bruising is there, then you have to understand that if there is any bruising in specific area, it have to be concerned, like head, like cheek, the cheek having bruise mark. Should not be any it's not the area of get bruise. Neck, ear, trunk, arm, buttock, and genitalia. I got a patient. I mean, the child they want to say that um, this child have got fracture without any fall. Okay, so the child is otherwise the child is okay, but so if it is there, then need to be more explanation. Okay. Um, so very important thing is genitalia bruise. If there is genitalia bruise or buttock area bruise, it's indicates some physical abuse is there, could be sexual abuse even. So a crawling child can have injury to the chin, nose, forehead. So it depends what about the child's age and is it explainable or not. So then you see that this child having, is it bruise marks? And what is these things? This is the tuberculosis mark. Okay, in some area they give tuberculosis. Sorry, it is a BCG uh, injection marks. Okay, BCG injection marks. This is not a bruise mark. Okay, and B chest and A is having bruise marks. So you have to be alert on this. But it was later proved that it is birthmark actually. Okay. So this is a case story was related to this was discussed. So can these pictures can produce some suspicion back of the, but there is some explanation can be there. Okay. Significant injury where no explanation, pattern suspicion, slight suspicion. Okay, so there is a very interesting case now. David is an 8-day-old baby who is brought to the emergency department by his 19-year-old mother. She is concerned about a lump that she felt on his collarbone. So only 8 days there is a lump. Okay, he was born at term, weight 4.6 kg following a vacuum extraction. So after doing the vacuum extraction, he was a big baby and vacuum extraction was done. Sleeps for 3 hours at a time and wakes to take his artificial milk feed. On examination, clean as deep appears well, weight, head circumference, both at 25th centimeter, generalized bruising to the crown of his head and circular bruising to the both sides of his chest. So the child having circular bruise, it could be by the vacuum extraction. At day 8, it could be, but both sides having chest, what is indicating by this circular bruise on the both side of the chest. There's a lump on his left clavicle also having a lump. So collarbone having fractured. Okay. When there is a difficult delivery, then it's very common to be fractured by the clavicle. Okay. Frenulum is intact. On examination, nape area, there is a severe ammoniacal dermatitis. So I said you how it has happened. Erythematous patches and scaling, the skin folds are spared. Skin folds are spared. It's also indicate it's ammoniacal dermatitis. You dilate his pupil on direct ophthalmoscopy, see retinal hemorrhage. So you see that retinal hemorrhage is there by the ophthalmoscopy. There is no other obvious injuries. Examination of his chest, heart, abdomen is normal. You arrange a chest X-ray for clavicle and demonstrate it is a fracture. Which of the following findings is David is most suggestive of non-accidental injury? Bruising to the crown, fracture, clavicle, oval shape, bruising on the both sides of the chest, retinal hemorrhage, severe ammoniacal dermatitis. So what indicate that it is a non-accidental injury? Severe ammoniacal dermatitis indicate neglect. It is not any non-accidental injury. It's not any abuse. Like it's not any fracture or bruise marks. It is not indicate. It's actually neglect. Many concerned mom having like this severe ammoniacal or any kinds of ammoniacal dermatitis. It can be. It's very common. Like mom is very tired and not changes the nappy, and mom is sleeping for 8 hours, and in between time mom is giving breast milk. So what will happen? Okay, but fracture clavicle can be accidental, yes, if it is like vacuum delivery or something. Bruising of the crown, explanation is there, but oval shaped bruising on the both side of the chest is not possible because the child can, sorry. So can be, what could be happen by oval shape bruising? So one of the explanation can be it is a resuscitation process. When the child requires resuscitation, we are giving pressure on the chest. But for the neonate, usually we do not give pressure on both sides of the chest, right? We are giving only the left side of the chest, and we are using our finger, thumb. Can we use our palm as well? But it is not both sides of the chest. So those who are practicing, they know that we are hold our both hands to the chest of the child and then take it to the left side. So why the bruising on the both side of the chest? There is any explanation? No. But retinal hemorrhage is common, those who have difficult delivery. And the study proved it that it could be 10% child who have difficult delivery. So C having no explanation. So C is the right answer. Any confusion with these things? What is the most important next investigation for David? If you have confusion, what will do? 25 hydroxyvitamin D serum level, calcium phosphate serum level, coagulation spin, CT head scan, and skeletal survey. What it could be? So I should explain it. That any child having non-accidental injury, in that time your task is to do some test. If you have confusion that it could be non-accidental injury, he said if it is less than 1 year, do the CT head scan. Okay, and if it is less than 2 years, do the skeletal survey. So most important next investigation, child's having any complaint of Okay, so search out the child having any consciousness related problem or not. No problem, right? Still, what I said, less than 1 year. Yes, I will explain. Okay, so it is CT head scan. So the rules is less than 1 year, although it is not said that child having any consciousness related problem. What is said here? No problem. Still, you have to take the CT head scan. I already said that child is less than 1 year CT head scan. Less than 2 years, with the CT head scan also, you have to do the skeletal survey. But both are important, remember. But for this scenario, we will take CT head scan. And why not severe ammoniacal dermatitis? I said that severe ammoniacal dermatitis is one form of neglect. It can be happen with a mother who is very loved one. Okay, but mom is tired. Can be mom tired, mom having some mental being a 8 days mom, it is 8 days child mom, it is difficult to adjust. So it can be mom not understand the process of changing the diaper, so you don't know that have to be changed frequently, otherwise this can be happen. And it is even, I see many patients who having severe ammoniacal dermatitis, but parents is actually not that much callous, but it's happened. For example, they are in a situation where they cannot change diaper. So first of all, you have to understand that how much injury can be there. So severe ammoniacal dermatitis is having treatable option, but oval shaped bruising on the both side of the chest, you cannot explain. So any kinds of non-accidental injury, most important things is you have to understand that is it explainable or not. Understand my point? Is it explainable or not? So by the both hand you are using, it explain both sides of the chest why this bruise marks. It's not present at birth. If it is there, then it would be mentioned in the scenario. Okay, get my point? You have to imagine. Okay. Then what should be so what should be your contact next? Who should you contact next? GP, health visitor, police, social care service, child's father, who you will contact. Really it is difficult if you not understand the whole things, how it could be or not. So you have to talk with the social care service. Maybe something abnormality is there and social service is aware of it. So you have to talk with the social care service, not health visitor. Although to 5 days, the child is taken care by the social health midwives, okay, or health visitor and midwives mainly. So they are daily visit the child and they are taking care of the mom and the child. After the social service will taken care of this. Social service knows where this kid is. Okay, up to 5 years. Regularly visit. They regularly, school teacher also regularly see that is there any mark in the body anywhere, anything suspicious. Sometimes they ask also, is there any problem within your family? So something like. There is a one film you see, Rani Mukherjee films, Norway, something. I forgot the name. Norway, something like this. I didn't which things is there, but it was related to this social services taken social services taking care of the childs, and I didn't go through the movie, but it was related to this. But I see many others like GPs behind the door, many These are the things they are. These issues are discussed in this. It's called not movie. It's their television serial. The jeep is behind the door, and many issues are related to this. It's not uncommon. It's very common. Maybe. Okay, a 3 years old boy whose parents to the emergency department with bush. So let us discuss one AKP case. 3 years old boy is brought to the emergency department by a police officer and neighbor who had found him wandered in the street. The child is disheveled, smells of urine. Both his parents attend a short while later and are antagonistic to each other. They are not married and do not live together. Child has been in the care of each of the parents and his maternal grandmother during the day. Maternal grandmother and a duty social worker both appeared in the department. Just a minute. So 3 years ball to the emergency department by okay. So what happened here? 3 years child. Um, he was found wandering in the street. So 3 years child should not be out of their parents. Child was disheveled and smells of urine is there. Both his parents attend a short while later and are antagonistic to each other. They are not married and do not live together. So they have quarrel in between the parents. Child has been in the care of each of the parents and his maternal grandmother during the day. The maternal grandmother and duty social worker both appears in the department. So actually, grandparents was looking after and it happens. The examiner confirms the unkempt appearance of this child and identify a bruise caused by a hand slap. A hand slap was given on the face of the child. The bruise is this bruise is purple in color. They are bruised on the spine as well. Spinal bruise and slap mark on the face. The child is otherwise well and playing comfortably in the department. He plays comfortably with the mother, father, and maternal grandmother. Both parents deny knowledge of the facial bruise. So they deny that they're having any. Why this child having facial bruise? So which of the following is the most appropriate placement of the child over next 24 hours? Admit the child to the hospital, allow the child to go to home to his maternal grandparent, allow the child to go home by his parents, allow the child to go to stay with the neighbor. The social worker should place the child in the emergency foster placement. What do you think? Is required emergency foster? So, slapping is not acceptable in the UK. So you can give a small slap. Actually, I should say facial slapping. Facial slapping is not accepted. You can slap on the back of the child's maybe. It will not create an impression, but face is the place where if anyone gives slap, then fair person can have, impression. So it can cause problem, social service will be involved there if they understand. But is it like really cause any danger? Slapping is not dangerous. It can be there. It could be there. But why you want to say this emergency foster placement? What happened? The child is maternal grandparents forget and the child, is not taken. If it is neglect, do you think could be neglect? Why not it is neglect? Why you are not thinking of brush is a neglect. I mean, facial, only for the facial slap? No. Bruise in the spine indicate that there could be non-accident. You cannot explain bruising in the spine at a 3 years old child. Child can be fall, can be bruise marks on the front of the leg, but not in the spine. So you require to explain it. Okay, explain it. So you have to take the child to the emergency foster placement, because already they proved they are not giving all kinds of support. So which are following observation without an explanation suggests non-accidental. Bruising at the elbow, bruising on the pinna of ear, bruising of the forehead, bruising of the thigh, multiple bruising different edges on the shin. So what do you think for this child? What is the important things? I mean, which can indicate non-accidental injury? Different, multiple bruise of different ages. So think of your child. Can be bruised 3 years old child? Yes, why not? Many child having bruising, even at this age, my girls having, my daughters, having some bruise marks on the leg, because every time if mosquito bite, then he started to scratching and then bruise mark happened. But it is not possible on the pinna of ears other than non-accidental injury. Okay, so it cannot be explained. So bruising of the pinna of the ear is not explainable. So that's the things. Okay, explanation is very important here. Okay, so this case actually helps you to understand the whole things very nicely. Just a minute, I'm just checking. Then go for the next. So burn or scar. Some childs can be burned. Okay, so it's not signify that it is happen intentionally. Can be like unintentionally also can be. Okay, but if accidental burn, then the things would be like it would be asymmetrical. So splash of just think over that whenever we have accidental burn, whenever we are working in the kitchen, so having accidental burn. So is it symmetrically happen or asymmetrically? Different shape and sizes. Yes, accidental, asymmetrical, different shape and sizes could be, even for the child. They do not have clear margin. And it is usually happen upper part of the body. But non-accidental burn, it would be symmetrical. So like the iron is given to the childs, okay, hot iron. If you impose over the childs, then they will do it symmetrically. They have clear margin and can be lower extremities, buttock area, that is the hidden part, okay. And glove stocking described. So glove stocking means like anyone take the child's hand and take it to the hot water. So it will give an impression of glove stocking. Understand my point? Okay. So that's the things. And then bite mark. So it's highly suspicious. Adult bite marks. It could be oval, it could be circular, U-shaped. Okay. Forensic odontologist or dentist is required. If you require, then you will take help from the forensic odontologist and dentist. But adult bite mark is suspicious, but child can be bite to each other. So it can be happen like 3 years, 5 years child, so they can be bite, but it's mentioned about adult bite mark. Okay, so fracture, already I said, multiple fracture, supracondylar fracture, metaphyseal fracture, femur fracture, skull fracture, humerus, midshaft, suspicious. But there is very important things, posterior rib fracture. So posterior rib fracture also proved require intensive force. It is not accidental. Rib fracture having highest probability of abuse, they said. Even usually whenever we do the resuscitation, it's not cause any fracture usually. Okay. And another things, sometimes if you do the x-ray and you will get posterior healed lesion. Okay, healed lesion on the front of the costochondral junction or x-ray, healed lesion. So if healed lesion repeatedly you are getting, so if you get one healed lesion and it's not explained appropriately, you have to give it again another x-ray after 2 weeks, and you would have to check new lesion is there or not. And in that case, is confusing case, you can advise for the bone scan, because sometimes some x-ray cannot identify fracture. Okay. So bone scan less than 2 years, you given, and its Royal College of Pediatric Child Health guidelines say that a single skeletal survey will miss fracture. So have to done repeatedly. So less than 1 week, acute, recent 1 to 5 weeks, old more than 5 weeks. So it can be explained by the radiologist. Okay. So it is again good explanation is there. I will discuss these things later. This SOP related things tomorrow, whenever I do discussion, then SOP related things again discuss. Okay. And some task cases remaining there, I'm aware of it. I will discuss that time. Sexual abuse. So sexual abuse can be happen. So already we say that it can be touched way or non-touched way. It can be penetrative, non-penetrative. In that cases, we have to keep the child in safe, and there can be clear-cut rape attempt or not. So main things is, if it is happened, then you have to give the referral to the local authority as early as possible, and you have to involve the team. Okay, so gynecologist will be there. Any child who is in rape or sexual abuse happen, then on-call consultant will be there immediately. So I said you that safeguarding consultant. Bleeding child protection agency may be involved there. Whether where child abuse is suspected, then yeah. So you have to fulfill a form which is known as sexual assault referral center, not form. Center is sexual assault referral center. Then they will take the case, and they will take the photograph, necessary documents, forensic medicine will be involved. Female gynecologist will be involved, anesthetist if required, like examination, and have to do the pregnancy test, have to give the emergency contraceptive advice. Okay. And have to done the sexually transmitted infection screening. Is there any chance of HIV transmission or not? And in that cases, emergency here give the medicine. Okay. Usually no question from here, but it was from the yes. So it was discussed in the infection chapter. Some things. So here Sally is a 15 years old girl who attends the walks in the center with a white creamy vaginal discharge. She was initially reluctant to disclose any sexual activity, but further discussion, she tells you that she has unprotected sex for the first time with her 16 years old boyfriend 6 days previously as a party. She had planned to have sex with him at the right and had drunk some alcohol at the party, but realized being drunk when she had sex. Sally would like to practice her the morning after pill. Sally asked if it was legal to have consensual sex at her age. So 15 years old, having this sexually transmitted infection, maybe they are white creamy vaginal teachers, but she was sex with 16 years old boyfriend, and she was not drunk. She was not in the drunk situation. So is it legal? Which of the following is the best response? It is illegal if the boys is likely to be prosecuted. It is illegal and you have to duty to inform the social service. It is illegal, however, no further action will be taken. It is legal as long as one partner is over 16. It's legal as long as she has not drunk. Can you please take the right option? Yes, exactly. C is the right option. It's illegal. However, no further action will be taken. Yes, it is illegal, but no further action will be taken. Okay. Because less than 18 years, it is illegal. But you cannot take the further action because of they have the right to give consent if mental capacity is there. So another thing is abusive head trauma or shaken baby syndrome. So those who have like sometimes it's happened after birth, if like anyone usually shake the baby, then they will have intracranial injury. Okay, so it is due to shaken. Okay, it is known as shaken baby syndrome. Any child who having unexplained drowsiness or irritability, one of the important differentials could be meningitis. But you have to remember that it could be also shaken baby syndrome. Sudden new onset seizure and low Glasgow Coma scale. So unconsciousness, you have to think over the shaken baby syndrome. So how can it be proved? So, any child having this unusual drowsiness, or if you understand that it's not meningitis, even if you think you have to do the LP, you have to do the CT scan, right? And then after CT scan, you can confirm it also by the MRI, okay? Because MRI can detect more appropriately. But initially, if child unstable, you can do only the skeletal survey that can prove. Okay. So remember this abusive head trauma or shaken baby syndrome. We already discussed the non-accidental injury, how it is said, and yeah, we already discussed these things. There is self-harm issue. So some childs can be self-harm, it is their mental, they having some mental issues there so that they can do their self-harm. It is not in a normal mental condition, especially if any suicidal tendency, then it can be required psychiatric assessment. But it is said that sometimes parents are do fabricated illness as well or induced illness. Okay, it is called Munchausen's by the proxy. Okay, so like they said that my child having hematuria, and you see the child having red urine, and it is done by taking some blood on repeatedly they are saying, and if you see the urine you can get here RBC, but it was actually pretended or fabricated. Okay. Now it is said fabricating symptoms or induced illness, although it was said before a different way. But there is no questions related to this. So just something I will say about sudden infant death syndrome. That sudden infant death can be there usually child without any explanation if death within the infantile time, then it's called sudden infant death syndrome. It's more common around the 2 months, and it is can be due to different causes. So previously there is more sudden infant death syndrome when metabolic cause was not identified, but nowadays metabolic cause is identified. So sudden infant death syndrome become less, because after birth immediately day 5 screening test can understand that this child can have some metabolic disorder. So they give you some advice that can be with the approach you can prevent sudden infant death syndrome. For example, breastfeeding can prevent, and their bed should be separate. It should not be on the same bed, but they should say that the child should be in the same room, but separate bed. Okay, so cot could be, but it should not be like within the same bed. And sleeping position should not be prone, it should be supine. And they say that parents, especially mother, should not take alcohol. And many actually study prove that drug alcohol use is directly related. And the bedding should be comfortable, appropriate temperature should be there. But whenever they have they are advised the pacifier. So pacifiers having no clear-cut evidence that pacifiers can prevent sudden infant death syndrome, but it is advised not to use first 4 weeks because that time required to establish the breastfeeding. Okay, but other than they can give, some country advocate to use seeds, not in the UK, but some countries, especially USA, they say that use like pacifier to reduce the SIDS. Okay, so most important things is to keep the child not too prone but supine, and another things is not share the bed. Okay, so this is another things. I think we'll discuss this task issues later. So tomorrow we'll discuss some task issues, some task case and other things, and also the recall. But for now it is, I think, enough, and then we will discuss later. Yeah. So any questions so far?